the amount of decline of vaccinated children. Because again, a lot of people came out of COVID and didn't trust and still don't trust the vaccine that was created for that disease, that illness. But now that we are talking about others, there are 17 total diseases that can be controlled with vaccines. Again, things like measles, mumps, rubella, polio, influenza, shingles is one of them. Of course, that's not in children, but that's one of the 17 that can be prevented with vaccines. Looks like we're getting a little bit closer as we will wait for this meeting to begin. It should be starting here any minute. Again, Dr. Bruce Vanderhoff will be joined really by one of the nation's top, or what's described as one of the nation's, I want to get his credentials, is Dr. Paul Offit. He is a nationally renowned immunologist and director of the Vaccine Education Center at the Children's Hospital of Philadelphia. And so we've seen these news conferences held in the past by Dr. Bruce Vanderhoff, and it is in the past other news conferences that he's held have been on the dangers of smoking and of course COVID, but we really are paying attention to this one because there are so many parents out there watching. We are getting close to the start of the school year where shots need to be updated. That'll be, of course, probably a topic of conversation here as we wait for the meeting to begin, and it looks like we are there. So let's take you
granted, please leave us
live to this.
Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
There we go.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. I'd like to start today by briefly discussing COVID-19. We've clearly seen an uptick in cases in recent weeks from about 1,000 cases per week a month or so ago to more than 3,000 in the past few weeks. Nevertheless, it's important to note that these case levels remain well below what we were seeing in January of this year, when, for example, we were reporting between 10,000 and 12,000 cases per week. Now, I've been watching these numbers very closely. And it's interesting that the current pattern of COVID activity here in Ohio looks very similar to what we were seeing heading into the late summer of last year. A rise from very low levels that then led to a fall and early winter surge in cases. Now, thankfully, the variants we're currently seeing circulating remain in the Omicron family. And while very communicable, they are not driving the marked increases in hospitalizations and deaths that we saw during much of the pandemic. That said, it's clear that COVID, like influenza, remains a very real health threat, especially for the medically vulnerable and those over the age of 65. And any increase in cases should remind us of the importance of staying up to date with vaccination. An updated vaccine for the 2024-2025 season was recently approved and should be available in the coming weeks. The CDC has recommended that everyone ages 6 months of age and older receive the updated 24-25 COVID-19 vaccine to protect against the potentially serious outcomes of COVID-19 this fall and winter, whether or not they have ever previously been vaccinated with a COVID-19 vaccine. Last season, people who received the 23-24 vaccine saw greater protection against illness and hospitalization than those who didn't receive the vaccine. And vaccination clearly remains the best way to prevent severe illness from COVID-19. Well, we're moving through summer quickly and enjoying the warm weather and Ohio's great fairs, including, of course, the Ohio State Fair, which opens this week. Naturally, our young students look at the calendar and see that they have at least several more weeks of summer vacation, but their parents know that back to school time is approaching us quickly. And as the state's health director, one of my top priorities when talking about this time of year is to emphasize the importance of well childcare and ensuring your children are staying up to date with recommended childhood vaccinations. Now, sometimes we may feel like these vaccines are for diseases of the past, diseases that are no longer relevant today. But all too often, we're encountering proof that this simply isn't true. We continue to see tragic cases of so many of these vaccine-preventable illnesses popping up right here in Ohio. Now, I've talked recently about measles cases in Ohio, and we've had 7 of them this year. Looking back just a little, we're not far removed from a sizable measles outbreak that happened here in Ohio in the fall of 2022. We also have had outbreaks of pertussis or whooping cough, meningococcal disease, and mumps. All of these diseases are covered by the recommended childhood vaccines. A lot of careful thought goes into the development of the recommended list of vaccines, and yet Ohio's rate of vaccination among our kindergartners, which is our best barometer of statewide childhood vaccination rates, fell slightly in the 2023-2024 school year. The percentage of kindergartners who are up to date on all the recommended vaccines slipped from 86.5% in the 22-23 school year to 86.2% this past school year. Now, that's a small drop, granted, but this comes on the heels of a rebound in rates between 21-22 and 22-23, which was really the first school year that we emerged from the pandemic. We were hopeful that rates would continue to rebound and perhaps get back soon to pre-pandemic levels, which were close to 90%, but that just hasn't happened. Now, this is not merely an Ohio phenomenon. Just last week, the CDC issued a call to action on this topic, stating that their data is showing that kindergarten vaccination rates have declined to their lowest level in decades across the nation. The call to action was to encourage state health departments and other public health agencies to do all we can to promote kindergarten vaccination readiness. ODH, of course, has ongoing outreach efforts, including provider-based education, grants to local health departments to promote vaccination, and we also work closely with the schools themselves through our school nursing program. But we also run regular communication campaigns to promote vaccination, and we're preparing a robust multimedia campaign for this fall, which will include radio and television ads, as well as social media posts. This is such an important topic for the health of Ohio, especially for the health of our youth. And no one could be more knowledgeable about vaccination or more recognized on this topic than the guest we are so privileged to have with us here today. Dr. Paul Offit is director of the Vaccine Education Center at Children's Hospital of Philadelphia and an internationally recognized expert in the fields of virology and immunology. He was a member of the Advisory Committee on Immunization Practices to the Centers for Disease Control and Prevention. He is a member of the Institute of Medicine and co-editor of the foremost vaccine text, Vaccines. Dr. Offit has published more than 150 papers in medical and scientific journals and is also the co-inventor of a landmark rotavirus vaccine that is credited with saving the lives of large numbers of infants worldwide. Dr. Offit, welcome.
Thank you. Thanks for asking me.
I mentioned that the CDC is launching a national campaign to improve kindergarten vaccination rates, as the decline in vaccination rates we've seen in Ohio is also happening nationally. What do you think is driving these declines, and what role did the pandemic play in this?
Well, the pandemic clearly played a big role. I mean, people were uncomfortable going to settings where there were groups of people gathered together indoors, and so immunization rates declined fairly dramatically. I mean, if you define pandemic as something that changes the way that we live, work, or play, I think you can argue that the pandemic is over, but the virus isn't over. So SARS-CoV-2 virus, the cause of COVID, will continue to circulate. And I think vaccines are largely a victim of their own success. People aren't afraid of these diseases anymore. And take measles, which is the perfect example, and one unfortunately you've had to experience in Ohio. This was a virus that we eliminated from the United States by the year 2000, which is to say that although the virus would occasionally be brought in from other countries where it was still circulating, we didn't see any spread from one American child to the next for at least a year. But measles is back. It's the most contagious of the vaccine preventable diseases, and therefore it is the canary in the coal mine. Whenever you see any sort of erosion in vaccine rates, it's measles that you see. And I think people forget measles. I mean, I'm a child of the 1950s, as you can see, because this is a video. I'm an old person. So, I mean, I had measles. Measles vaccine wasn't until 1963. But before that vaccine, every year there'd be 48,000 children who were hospitalized by measles, about 500 who would die from measles pneumonia or measles encephalitis, meaning inflammation of the brain, or dehydration. Measles was a bad disease. People were scared of measles. And I think we're not as scared now, which is unfortunate. But I hope we don't have to remember this disease by seeing it again. And I think that's sort of where we're heading.
Yeah. You know, when we talk about the kindergarten vaccination percentages, and here in Ohio, as I said, it's around 86%. Some people, I think, might hear that and say, you know, I think that sounds like a pretty good rate. Why should we want those rates to be higher? And what rates should we be reasonably striving for?
Right. Well, measles is a good example. You really need immunization rates in the mid 90% range to provide so-called herd immunity, meaning there's enough of a population that's vaccinated so that you really can't get spread from one to the next. And those, because remember, not everybody can be vaccinated. I mean, there's millions of people in this country who, because they're immune suppressed for their cancers or rheumatologic diseases, can't be vaccinated. They depend on those around them to be vaccinated. And to put this in perspective, there's something called a contagiousness index, or R naught. And for viruses like SARS-CoV-2, the cause of COVID, or influenza, the R naught is about 2 to 4, meaning that if you're infected and you go about your normal day, you'll infect 2 to 4 other people. With measles, the R naught is 18. It is the most contagious. And so that's why it requires the highest level of population immunity. And when you start to see population immunity erode, and even immunization rates in the high 80% range is not good enough to stop spread of that kind of virus.
Yeah. You know, so thinking about those vaccine rates, I know from my conversation with parents all over the state that there are parents who have very sincere reservations about vaccination. They may be hearing a lot of conflicting information. In fact, I still hear parents who have concerns about things like autism. I know you have spoken nationally on this topic, and wondered if you could share with our audience some of your thoughts about vaccine safety and specifically concerns that still swirl around the MMR vaccine.
Right. It's actually remarkable to me how once you've rung the bell, it's almost impossible to unring it. The MMR, or measles, mumps, rubella vaccine, is a cause of autism story. It's a perfect example. So here was a British gastroenterologist and surgeon who in 1998 published a paper, which was really not a study of any kind. It was just a case series of 8 children who got an MMR vaccine, and then within months of that, receiving that vaccine, developed signs and symptoms of autism, which proved only that MMR vaccine doesn't prevent autism. It only prevents measles, mumps, and rubella infection. Nonetheless, it took off. I mean, there were thousands of parents in England that chose not to vaccinate their children because the media carried this story as if it was some sort of fact. Hundreds were hospitalized, and about 4 children died of measles in England unnecessarily because of this sort of false fear. Within weeks, there were studies that started to be done to answer the question: are you at greater risk of getting autism if you've gotten the vaccine or not? And the question's perfectly reasonable, right? My child was fine. They got this vaccine, and now they have a problem. Could the vaccine have done it? Fair enough. That's a scientific question. It can be answered in a scientific venue. What you do is you look retrospectively at children who did or didn't get that vaccine, make sure that those two groups are alike in terms of healthcare seeking behavior, medical background, socioeconomic background, so you can isolate the effect of that one variable, receipt of MMR vaccine. That study has been done 18 times in 7 different countries on 3 different continents, costing tens of millions of dollars, which is to say that the public health and academic community responded and responded quickly and well. And in every case, there's no evidence that the MMR vaccine causes autism. And I think most parents of children with autism now understand that. But still, there's a solid 10 or 15% who thinks that the vaccines may cause it. You look at people like Robert F. Kennedy Jr., who are still sort of sounding that alarm. So what does it take to sort of quell fears? Yeah, I do think once you rung a bell, it's very, very hard to unring it. I've said before that I think there's no study there's no story like no story in some ways. Like a story that says MMR doesn't cause autism in some ways causes people to say, wait a second, that was a problem, that was an issue. Maybe I should skip this vaccine. So it's
Yeah, no. So think about vaccine safety. I have spoken often about how careful and thoughtful the process is in terms of approving and then recommending vaccines for children. And you've been on the CDC's advisory committee. You've worked with the FDA. Can you share for Ohioans just a little bit about how thorough that process is, how focused people really are, scientists really are on the safety of our children, and therefore how confident parents should feel in trusting recommended vaccines?
Sure. So I'm actually currently on the FDA's Vaccine Advisory Committee and have been since 2017. So in 2020, when we were asked to consider Pfizer's mRNA vaccine on December 10th of 2020 and Moderna's on December 17th of 2020, for the way those meetings work is that you get about 150 to 200 pages of documents from the company and roughly the same number of pages from the FDA, who review every single piece of information from the company and make sure there's no misrepresentation or obfuscation of data. And so here's how this works. I mean, so the Pfizer study, for example, was a 40,000 person study, meaning 20,000 got the vaccine, 20,000 got placebo. The Moderna vaccine was a 30,000 person study. 15,000 got the vaccine, 15,000 placebo. That means that here's this technology. Here's this virus that came into this country in January of 2020 that was then sequenced, isolated and sequenced. 11 months later, you had a vaccine using a technology that had never been used before. We had no experience with messenger RNA as a vaccine strategy. And you're looking at data in December of 2020 of essentially 35,000 people who got the vaccine, knowing the vaccine is about to be given to hundreds of millions and billions of people, and knowing that another shoe will drop. Because it has to, because that you're not going to pick up rare adverse events pre-licensure, or in this case, pre-authorization. That's not going to happen. So you're just holding your breath to see what that's going to be. But the good news is, you know that there are safety systems in place to pick it up quickly, and that's what happened. I mean, if you look at for example, the so-called vaccine adverse events reporting system, very quickly, within a couple months, picked up myocarditis, meaning inflammation of the heart muscle, as a consequence of mRNA vaccines, and then the so-called vaccine safety data link, which can look at those who got vaccinated and not, and therefore assign sort of a relative risk. You could see that it occurred in about 1 in 50,000 people. So that's too rare to pick up pre-authorization, but it was picked up very quickly post-authorization. Same thing with Johnson & Johnson's vaccine, right? The so-called vector virus vaccine, which came out in February of 2021. Again, very quickly, within a couple months, you pick that vaccine up. The problem of a clotting problem, which could be severe, and it could be clotting in the brain, which could be fatal. And that occurred in roughly 1 in 250,000 people. Those are rare events, and very quickly picked up, and ultimately drove the J&J vaccine off the market in May of 2023. So I would say this, and I wish there was an easier way to say this: there has never been a medical advance in human history, whether it's vaccines or antibiotics or anesthesia or X-rays or whatever, that has not been associated with some human price for knowledge. There always is a human price for knowledge, and we have difficulty accepting that, and I can understand why. But there are systems in place that understand that can pick that up very quickly and often define a biological mechanism, which was true with the J&J vaccine.
So now I'm going to take that same question and sort of reframe it a little bit. and ask you to think in terms of your long experience, not only taking care of sick children, but especially teaching medical students and young doctors. And what advice can you offer medical professionals who are having conversations with parents in the office who may be still hesitant about currently recommended childhood vaccines? What is your advice to those physicians in terms of your experience with how best to address those concerns?
By long experience, you mean I'm old? No, I get that. That's fine. No, I'm just kidding. I think you should be skeptical of anything you put into your body, including vaccines, which are biologicals that are being given to healthy young children. I think anybody should be a little hesitant about that and should want to make sure they know all the facts associated with that. It is an understandable concern. But I think what people need to understand is that there are no risk-free choices. A choice not to get a vaccine is not a risk-free choice. It's a choice to take a different risk. So I think when parents come into my office and are hesitant, the first thing is try and figure out what it is that they're concerned about. And often there are data to sort of answer that concern and to try and provide those data in a passionate and compassionate and compelling way. But to get people to understand that there aren't risk-free choices. A choice not to get a vaccine is a different risk. And with COVID, pretty much everyone in this country has gotten either vaccinated or naturally infected. And I wish there was a different word for naturally infected, because the term natural has a sort of a positive sense. And Mother Nature, frankly, has been trying to kill us ever since we crawled out of the ocean onto land. So I don't know who her PR people are, but they're really good at what they do.
Well, thank you very much, Dr. Offit. Before I wrap up today, I wanted to briefly mention some of the other topics to consider when it comes to back to school safety and the health of our school-aged children. Well, one consideration is ensuring your children have a safe route to school. Parents should practice the walk or bike ride to school or getting to the bus stop before that first day of school. If your child's biking, please make sure they have a protective and well-fitting bike helmet. Earlier this month, Governor Mike DeWine and the Ohio Department of Transportation announced an investment of more than $8 million in projects that focus on the safety of children who walk or bike to school. This is part of ODOT's Safe Routes to School program, which supports building infrastructure such as sidewalks and enhanced pedestrian crossings. ODH assists ODOT in selecting these projects, and this year, the program is funding 29 projects in 19 counties. I also want to emphasize the importance of good nutrition, which can help your child be more alert and receptive at school. The Ohio Department of Education and Workforce posts lots of good information with links on their website. Also, your children may be eligible for your school's free or reduced breakfast or lunch program, and if so, please make sure they're enrolled in that program. It's my hope that we'll all enjoy the rest of our summer while also doing all we can to ensure our children stay safe and healthy as we head into the coming school year. Thank you, Ken, and I think we can open it up to questions.
Okay, our first question today comes from Dan DeRoos with WOIO TV.
Good morning, doctors from Cleveland. Certainly appreciate the time today. Sort of a two-part question here. Dr. Bruce Vanderhoff, are there no state requirements for what shots kids have to have before they go to kindergarten or before they go to school? Is that a county level thing? Is that a school level issue? And then what do you say to parents who are never vaxxers because of COVID-19? COVID-19 vaccines have been developed in the last 3, 4, 5 years. MMR, polio vaccine, we're talking 50, 60 years that these have been around. How do you convince never vaxxer parents to trust something like an MMR or polio?
Yeah, so I'll certainly start. The beginning of your question really relates to vaccine requirements. And state law does require completion of certain vaccinations in order to attend school, or proof of an exemption for medical reasons or reasons of religion or conscience. And it's interesting that exemptions among incoming kindergartners have really increased fairly significantly in recent years. But the bottom line is what that means is that for our schools, they're really still completely reliant upon the parental decision regarding these vaccines. So yes, we do as a state set expectations around the vaccines, and we do recommend the national list of recommended childhood vaccines. But ultimately, this is a parental decision. And that's the reason that we are working so hard and so consistently to get that message across. And I'm sorry, I forgot the second part of your question.
Just discussing never vaxxers and how do you get through to a never vaxxer that something like polio has been around for 50, 60 years?
Yeah. So I'll begin that, and then I'm going to turn to Dr. Offit, who has tremendous experience in this area. You know, I think one of the ways that we reach parents around this important decision is just continuing to share information to make parents aware that we are not in a bubble in which we can count on never encountering these very, very bad viruses. They have occurred in Ohio, they've occurred in other states, and as they do, I think you'll notice that both the Department of Health, through our many communication channels, and I through these press conferences, pretty consistently share that information and make sure that people are well aware that these viruses are out there, they cause real harm, and they're preventable. And I think they provide unfortunate but very real world examples of why it's so important for us to stay on top of these. Dr. Offit, any further thoughts you may have about this topic?
I think that for example, we've eliminated smallpox from the face of the earth. I got the smallpox vaccine. My children didn't, because the virus wasn't around anymore. So I that's good. But when people say, you know, I don't worry about polio, I don't worry about measles, I don't really see those diseases, I don't worry about, you know, rubella, German measles, but those viruses are around, and you need look no further than New York State in 2022, where a 27-year-old man got polio. He never left this country. If you looked in the wastewater samples, both in his county as well as surrounding counties, there was polio, and he had immunization rates in his particular area code of 30%. And that's why it was that he got polio. Drop immunization rates far enough, and you'll see polio come back. And if you think that it's only, for example, in the wastewater in those New York counties, what I've been pushing the CDC to do, as many have done, look in the wastewater of many, look in Philadelphia, look in Los Angeles, look in Colorado, look elsewhere. You're going to see polio virus, revertant virus from the oral polio vaccine. You're going to see that in the wastewater. It's there. Don't play. This is a dangerous game to play. In answer to your question, the never vaxxer. So I think if you'd asked me at the beginning of the COVID pandemic, how did I think vaccines would fare after this, we introduced them, I would have thought people would have seen them the way I saw them, is a lifesaver. I mean, I would argue I was informed about that vaccine. I read all, sort of 400 pages or 800 pages for both those first two vaccines. I think I was informed. I couldn't wait to be vaccinated. I practically cried when I got my first vaccine, because now I had some measure of protection other than just avoiding human-to-human contact. But that's not how that vaccine was perceived as we look now years later. And I think the reason was mandates. I think when we mandated that vaccine, not only for sort of school entry, but also for hospital entry and religious ceremonies and sporting events, et cetera, I think people saw that as the government being too heavy-handed. And they really pushed back. So although within 6 or 7 months of that vaccine coming out in December 2020, we inoculated 70% of the population, which is also amazing. 30% said no. I don't want to get vaccinated, despite the fact that thousands of people were dying a day. This was a virus you could see right in front of you. It's not like asking people to get a rubella vaccine or German measles vaccine. It was right there, and still people didn't want it. And I think that was it. It was this sort of libertarian notion. I think we leaned into this libertarian left hook, which affected not only COVID vaccines, but I think all vaccines. I think it sort of spilled over into all mandates. And you can see that. I mean, you can see this sort of pushback on mandates in the political world.
Okay, our next question comes from Samantha Hendrickson from the Columbus Dispatch.
Doctors, thank you for your time. One quickly, and then my main question. So you mentioned the numbers slipped slightly in that vaccination rate percentage. Are you able to provide those to us? And then my main question sort of flips the other one on its head in that you have parents who believe in vaccines, but they might be encountering people more and more whose children are not vaccinated, whether that be in school or on the playground or have family members. What advice would you give to them, either in keeping their children healthy or themselves healthy, or if difficult conversations are brought up in those scenarios?
Yeah, so first of all, in terms of vaccine numbers, absolutely. I'll run through this real quick. Ken would also have this available offline if you need him subsequently. But what we saw was, now this is by school year, and this is for our kindergarten vaccination rates. For 2019, 2020, we were at 89.9%, so almost 90%. 2020 to 2021, 86.5. So you see a big drop there. Then 21 to 22, 85.6%. 22 to 23, we saw a bump back up to 86.5%. And then 23 to 24, 86.2%. So those are those numbers. You know, I think the question that you're asking about the safety of our children actually provides a really good illustration of why we as doctors really feel these childhood vaccinations are so important. I've said many, many times that our children, when they are out in the world, are not inside of a environment that is going to be free of these viruses that we know are circulating worldwide, because we live in a worldwide community, and it takes very little in this era of airplane travel for a virus to move from one part of the world to another and expose our children. But the good news is that these vaccines are highly effective. They are very safe. They've been used for a very long time. And I think the best step that a parent can take is to have their child vaccinated with the age-appropriate recommended vaccines. These, as Dr. Offit and I have already stated and shared examples of, these are very real threats. These viruses are real threats to our children, and we have real and proven protections in the forms of these vaccines. Dr. Offit, I don't know if you have anything that you would want to add to that.
Yeah, just one thing, because I think it's an important question. I spend a fair amount of time with advocacy groups like Families Fighting Flu, Meningitis Angels, National Meningitis Association. So these are parents whose children suffered and often died from a vaccine-preventable disease because of a choice that they made. Chose not to get a meningococcal vaccine, then child dies of meningococcus. Same thing with influenza. And they, this is the unimaginable thing, ever losing a child. And so, but they often process this as this happened to me for a reason. And I'm going to now try and explain to people the importance of disease, the importance of the vaccine, but they all tell the same story. I never believed this could happen to me until it happens to you. And I think that's the sense that I get whenever sort of a parent walks out of my office, or when I see a child in the hospital and the child's unvaccinated, and I can't convince them. I just feel so sad that they now are putting their child at unnecessary risk. It's just really hard, because you see when you work in a hospital, you see what that risk looks like.
Okay, we have two more questions. I just, out of respect for Dr. Offit's time, please keep them to one question, each reporter, please. Our next question is from Sam Wildo, the Dayton Daily News.
Hi, thank you guys so much for your time today. My question is, and you guys might have touched on this already a little bit, but is appealing to parents enough to address these immunization rates, especially considering that Ohio is one of the easiest states for parents to opt their kids out of getting vaccinations because of that personal philosophy exemption?
Well, one of the things that's been very, very important in the practice of medicine has been the fact that we really do work with patients, and physicians have great respect for the doctor-patient relationship and the autonomy of our patients. And there is no question in my mind that as I have over many, many years interacted with many, many parents in the care of their children, that parents almost in every instance are very sincere in having the best interests of their children in mind. So I do think that we have a responsibility both in medicine and in other walks of life, including the press, to help get the accurate messages about the life-saving nature of vaccines and the incredible safety efforts that surround those vaccines to the parents who are decision makers. I really think that is the right approach. It is the approach that we take here in Ohio and across much of the nation. Parents, I think, do listen and take very seriously the information, but we have to, unfortunately, battle too often against misinformation or confusing information that they are trying to balance in the scales. Dr. Offit?
You know, it's so the parent makes a decision, as Dr. Vanderhoff said. They are responsible for the health of their children. But what do you do when they make a decision that you think isn't the right one? It's really hard. And so all 50 states have medical exemptions to vaccination. Obviously, if you have a medical issue that makes it so that you can't receive a vaccine, of course, you shouldn't be mandated to get one. Most states have so-called religious exemptions. About half the states have so-called philosophical exemptions. I would argue that those are misnamed. Philosophical exemption, I mean, philo, love, sophos, wisdom. Where's the wisdom that says it's better not to get a vaccine than get one? And a religious act, it seems to me, I know this is not terribly politically correct, but I just don't see how that's a religious act. It's religion teaches you to care about your children, care about your family, care about your neighbor. How does putting your child in harm's way count as a religious act? So I think those are misnamed. I just wish we'd name them appropriately, which is I'm a little scared about vaccines. I don't really understand what's in them. I don't think I need to get one because I don't see these diseases anymore. The exemption. Call it that, because at least that's more accurate. So it's hard. We're put in a position as physicians of, on the one hand, having to watch children suffer needlessly when a parent chooses not to vaccinate them, and on the other hand, having a legal system that has introduced these two non-medical exemptions. You look at, for example, up until recently, the only two states that didn't have that had only medical exemptions were not two you would have necessarily picked, which was Mississippi and West Virginia. And so two states you wouldn't, and those two states, because they only had medical exemptions, had the highest vaccine rates in the United States. Mississippi and West Virginia, I mean, not states that you would necessarily know for their public health achievements. And Mississippi recently introduced a religious exemption, and then 2,500 parents immediately decided that they were religious and chose not to get a vaccine. So I don't know. I really struggle with this because I agree completely with Dr. Vanderhoff. It's the parent's decision. But what do you do when you have to stand back and watch parents make a bad decision? And we've all watched it. I mean, I've seen parents choose not to get a pneumococcal vaccine, and then the child gets invasive pneumococcal disease. You feel you failed. You feel that you failed. And I don't know what to do other than to make a passionate case for why it's important to get vaccines. I mean, I watch my wife, sort of who's in private practice pediatrics, and deal with this in many ways much more than I do. And she basically, said she just gave up. She said, look, let me love your child. I can't send your child out of this office knowing you're putting them in harm's way. I can't do it. And if that's what you want to do, I can't see them. And with that, she actually became far more able to convince people because she was so passionate and clear and in many ways willing to say, I can't do it. And she went from like convincing about 25% of people to convincing 90% of people when she said, let me love your child.
Okay, our final question today comes from Xavier Hershowitz, WHIO TV.
Hey, doctors, thank you so much for your time. My question is, when it comes to these vaccine preventable diseases, what are your big concerns going into this school year?
Well, I'll begin, and it's really going to be a little bit of a repeat of what I said. I'll just expand on it. Look, we know that the vaccines that we have available as part of the routine childhood vaccination recommendations are safe. We've been using many of them for a very long time. We also know they're very effective. But we also know that increasingly we are seeing that here in Ohio, despite the fact that we're kind of in the middle portion of the country, we are not insulated from the reality of these illnesses being in various parts of the globe. So while we may not be seeing the active transmission, say, of measles here in Ohio because of our long history of vaccination, nevertheless, measles is active in other parts of the globe. And we have seen multiple instances of where that reality has brought the virus here to Ohio and infected unvaccinated, vulnerable people here in Ohio. And I could go on down the list of the vaccine preventable illnesses that we have seen over the last decade here in Ohio. And the reality is that that means that a child is going to become very ill, a child is going to suffer, a child is going to end up with a lifetime disability, or sadly, in some instances, a child is going to die. And we could have prevented that illness. So that, I think, is what drives our concern and our messaging and our plea to the parents of Ohio to give very, very serious consideration to getting the shot when your child's doctor at their well visit this summer and says your child is in need of a certain vaccine or group of vaccines. That pediatrician or family doctor or other healthcare provider is telling you that because they care about your child. Dr. Offit?
I think we're all sort of shaped by our experiences. My biggest fear is measles. I lived through that 3-month period between the winter of 1990, 1991 in Philadelphia, when we had 1,400 cases of measles and 9 deaths. I mean, it centered on 2 fundamentalist religious groups that chose not to vaccinate their families, and they had big families, and they were the epicenter. So they accounted for about 600 cases and 6 of the deaths, but it spread to the surrounding community where there were 900 cases and an additional 3 deaths. People were scared to come into the city. Schools canceled trips to the city. Philadelphia was a feared destination. And we got to the point where, I know this is going to sound anachronistic and you can't imagine this would ever happen in the United States, but it did because I was there. We had compulsory vaccination, meaning that those church members they had to be vaccinated by law. We had an ordinance passed in the city of Philadelphia where they had to be vaccinated. Now, what they were doing was perfectly legal. We had a religious exemption to vaccination in Philadelphia, but yet we were able to pass that law. And I remember one of the pastors of the church, one of the Faith Tabernacle Church, asked the American Civil Liberties Union to represent him. And you assumed that the ACLU would do that because what they were doing was perfectly legal. And the ACLU refused, saying that while you were at liberty to martyr yourself to your religion, you were not at liberty to martyr your child. And so the parents were great about it. They were perfectly willing to get vaccinated. Once by law, they were law abiding. But it was a desperate time. And when you live through that, when you see child after child being pulled out of the home dead from measles, you know what measles can do. Measles can kill you. And I think people they just see this as some rite of passage of childhood. And that's not what it was. Measles was a killer. And right now we've had about 330 cases in the last 4 years. Get to 1,000 or 2,000 cases a year and we'll see measles deaths again. And I just think it's unconscionable. And I feel like we're at some level falling off a cliff in slow motion here, because there's just such a negative feeling about vaccines, in many ways coming off of what I think was the mandates associated with COVID.
Dan DeRosa with 19 News as
thank
they're
you.
going to wrap up the news conference being held, and some powerful words there from one of the world's top immunologists in Dr. Offit out of the Philadelphia area. Some powerful words. Ohio has an exemption, has several exemptions for religion, but because there is that personal philosophy exemption, you're seeing kids get sick because parents are making the decision, and we're seeing a decline in vaccination rates. We'll have more on this coming up in our evening news. Watch for our 11 o'clock news in just about 15 minutes on CW43, then our noon news on Channel 19. Until then, I'm Dan DeRosa with 19. Have a great day.
19 News is everywhere. Download our CTV apps and follow us on social media @Cleveland 19 News.